Tonight, quarantined Americans in California demand better oversight after a patient who was pulled out of quarantine and tested positive for coronavirus was mistakenly released, rejoining the group, possibly making others sick. Separately, New York City health workers have cleared 7 people under observation. Airlines have canceled 85,000 flights to and from China.
The World Health Organization issues a new warning tonight.
This virus attacks every human being. No one is immune.
This as current and former American health officials line up before members of the U.S. Senate, urging the government to get ready quickly.
We're going to start to see those outbreaks emerge sometime in the next 2 to 4 weeks.
Plus, how one patient can infect so many so easily.
Sometimes that individual can infect 10, 15, 20, 30 more. Those are called super spreading events.
And tonight, an infected patient who tested positive just a few days ago tells us how she's feeling from her isolation room in a Japanese hospital.
I'm not allowed to leave my room, and I'm not allowed to interact with anybody else.
Plus, are the tests for this illness accurate enough to be relied upon? This CNBC special report, Outbreak Coronavirus, begins right now. Here's Tyler Mathisen.
And as usual, Meg Tirrell is with us tonight. Welcome, Meg. We'll get back to you with new reporting on the virus in just a moment's time. But first, folks, here are your latest numbers as of 7 p.m. on the East Coast. Just breaking in the last few minutes, a 14th case has been confirmed in the United States. This one in San Diego. That is the second case in that city. And not a big jump in coronavirus cases over the last 24 hours. We stand above the 45,000 mark with 1,100 fatalities as of now. And take a look at this. A company in southwestern China has built a tunnel to spray disinfectant on employees at an industrial complex before they come to work. It takes about 20 seconds per person. Well, top health officials were called to Capitol Hill today to testify on how the U.S. is preparing for a possible outbreak.
I don't think we should be planning for the onesie-twosie cases that we've been seeing thus far in the United States. I think we have to plan for something larger. I think that we have to plan for the possibility that we have thousands of cases.
We're observing a clustered outbreak of a significant scale in Asia. We do not have that situation in the United States today, so we're very alert. I don't think we're alarmed at this point, but we need to be leaning into what will the next step be if we can't contain it. Who's being tested? And if the asymptomatic or mildly ill people are not coming forward or not being tested, then we're obviously missing the rest of the iceberg.
Well, I'm joined by CNBC's Meg Tirrell and former FDA Commissioner Dr. Scott Gottlieb, who attended today's Senate hearing. Meg?
Well, thank you so much, Tyler. And Scott, you were, of course, testifying there. We heard some of the sound just now from today. What do you think was the most important message that you heard from the fellow people on the panel with you and that you were trying to impart to Congress?
Well, I think a building consensus right now that we're likely to see outbreaks here in the United States, and we need to lean in with diagnostic tests to try to ferret out those cases early before they become large outbreaks. There's going to be some human-to-human transmission in the community in the United States. We probably have cases that got through the various efforts we made to try to keep travelers out of the country. And we need to identify them quickly before we have larger spread. We're capable of doing that, but we need to lean in and start testing people now.
Are you surprised, Dr. Gottlieb, that there haven't been more cases in the U.S. so far? And when would you expect to start seeing a blossoming, if I could use that word, of cases?
Yeah, well, right now we're really dependent upon having enough cases that you have people identifying it at the hospitals basically with severe illness and getting reported to the CDC, because we don't have a diagnostic deployed where we're testing people who are presenting with unusual cases of pneumonia. We're really just testing people right now who present with symptoms of the coronavirus who recently traveled to China. So if we're dependent upon people being clinically observed as suspected cases, you're going to need hundreds of cases before you probably have enough unusual cases of pneumonia presenting to any one hospital that would alert health officials to call the CDC.
All right. We have just gotten word, Dr. Gottlieb, in the past few minutes and confirmed numbers out of Hubei province of 14,000 new confirmed cases there and 242 new deaths. What does that tell you?
Well, the 242 new deaths is deeply concerning because that's a big jump in deaths. And, you suspect that some of that might be people who had died previously and now are being categorized as having passed away from the virus. The 14,000 appears to be some of the suspected cases that are now being clinically diagnosed. So what China has said, what they appear to have said, is that they're no longer just waiting for a confirmed case subject to a diagnostic test, that if someone shows clinical signs of coronavirus and it's confirmed by a CT scan that they have changes in their lungs consistent with their virus, they're going to call that a positive case. So they seem to have moved some proportion of the 20-some-odd thousand people who were the suspected cases yesterday into confirmed cases today.
And Scott, you've been telling us that, of course, while China numbers are important, you are looking elsewhere now in other countries where we are seeing some sustained spread. Tell us about your concerns in other places like Singapore.
Well, China's now epidemic. We know that, and it's continuing to spread in China despite their efforts, really historic efforts to contain the spread. What I'm worried about right now and what I think we need to be looking towards is what's happening in Singapore, Hong Kong, Japan, where there appears to be community transmission, perhaps sustained community transmission in Singapore. And those countries are probably 3-4 weeks ahead of where we're going to be in terms of the spread in those nations. And so I think we need to look to those countries, see what's happening there as a harbinger of what could potentially happen here, and we need to prepare for that.